Following an injury to your elbow, your forearm, your wrist, or your hand, frequently people are placed into a cast or a splint to immobilize the joint or the injured area and give it time to heal. When people are in a splint or a cast, you have to still do your daily activities, so you learn to compensate or to move your body in ways that allow you to get every daily activity done. The problem with these compensation patterns is that when they stay around for too long, they can lead to additional injuries or to other problems that didn't come with the initial injury. 3 of those problems that we see starting at the forearm is that when people try to turn their palm up or down to say open a door or turn it, because the cast is on, they can't rotate the forearm. They learn to move their body or to kick their elbow out to try and make up for that lost movement. In therapy, what we try to do then is teach the person, keeping the elbow at the side, to rotate the palm down, rotate the palm up without any other body part moving. The second area we frequently see limited or immobilized from the cast is in the wrist. When it's held in a neutral or a straight position, the people still move their fingers. This makes the finger muscles extremely active and strong, so that when the cast comes off, those finger muscles are trying to move the wrist for you. The problem with this is when you go to open a bottle or to turn a jar lid, if the fingers are trying to help move the wrist, they can't grip onto that jar or that bottle. So what we want people to learn to do is, keeping the fingers relaxed or flexed, move only the wrist. This lets the wrist muscles move the wrist, then the finger muscles can grip that jar lid or open the bottle on their own. The third thing we'll see is in a cast, people can still move their fingers, but the cast will come down to allow their fingers to bend into it. This leads to a strengthening of the intrinsics or the small muscles inside the hand, so that when you make your fist, the big knuckles are moving first rather than the tips. This makes it difficult if you bend at the big knuckles to make a full fist, to hold on to small things, to hold change in your hand, or to grip tightly. What we want to see people do is bend the fingertips down to the palm, almost as though the fingernails are going to curl into the hand to be able to grip that small object. These compensation patterns, although useful when you're in the cast, can lead to additional injuries down the road. This is where therapy comes in handy. We retrain you to move the body correctly, to get the forearm moving the forearm, the wrist moving the wrist, and the fingers making a tight fist, so that you don't come back for a second session for a new injury.